Fisher & Paykel Healthcare is on a continuous mission to improve care and outcomes through inspired, world-leading healthcare solutions. Within our organisation, our dedicated team work together to achieve a common goal: to provide world-leading neonatal resuscitation solutions for the most vulnerable patient population during their crucial first few breaths of life. The transition from fetal to neonatal life is a newborn's first challenge. Most newborns can make this transition themselves. However, some may require extra support to initiate and sustain breathing. Preterm babies are at particular risk due to their underdeveloped lungs. Certain maternal and fetal factors can also contribute to late preterm and term babies requiring support at birth. To best support newborns during this critical period, it is important to understand what effective respiratory support provided at birth looks like.
A fetus's lungs are filled with fluid and they're not used for breathing, as the baby gets its oxygen from its mother via the umbilical cord and the placenta. At birth, the baby's first breaths push out this fluid and replace it with air so that the lungs can finally perform their role they're meant to. This step is critical for birth transition to occur. Manual positive pressure ventilation allows the clinician to quickly adapt ventilation provided to a newborn. This is usually a mixture of air and oxygen, and the aim is to deliver a pressure to the patient's lungs via a sealed interface.
During PPV, the peak inspiratory pressure, or PIP, is the highest pressure that's delivered to the lungs and inflates the lungs. The positive end expiratory pressure, or PEEP, is the pressure that the lung sees in between breaths. Another important factor is to maintain a steady and consistent breath rate, which allows time for the lung to inflate and deflate.
By delivering effective ventilation early, deterioration of the newborn and escalation of care required can be minimized.
Choosing the right mask size for the size of your infant, together with good mask hold technique, are really important for delivering accurate therapy. There's a few methods of delivering PPV to infants. When using a self-inflating bag, room air is pulled into the bag, and the inspiratory pressure is generated by the clinician squeezing the bag. With some devices, a little bit of PEEP can be generated by using an accessory PEEP valve or by connecting a flow of gas. Using a T-piece resuscitator, therapy pressures can be set and adjusted during therapy. And by connecting a blended flow of air and oxygen, it's possible to adjust and control the oxygen concentration precisely. PEEP is set and controlled on the circuit by adjusting the PEEP cap. The maximum pressure and the PIP are controlled on the resuscitator. When the clinician wants to deliver the inspiratory pressure, they occlude the PEEP cap with their finger. Pressures are consistent provided an effective seal is maintained and are visible on the resuscitator.
The lungs of newborns are susceptible to injury. Providing pressures that are too high can damage the lungs, and providing pressures that are too low can lead to ineffective ventilation. The consistent and controlled pressures provided using a T-piece resuscitator help prevent lung injury and also help establish and maintain functional residual capacity. Providing PEEP to preterm infants is particularly crucial as their lungs are underdeveloped and lack sufficient surfactant, which makes them prone to alveolar collapse. The International Liaison Committee on Resuscitation suggests the use of a T-piece resuscitator over a self-inflating bag when providing PPV at birth when resources permit. Preterm babies are particularly vulnerable to heat loss and becoming hypothermic. Along with other measures for providing thermal support, the use of heated and humidified gas should be considered when providing respiratory support at birth. There is good clinical evidence for the use of heated and humidified gases at birth to improve NICU admission hypothermia rates. Based on this, the International Liaison Committee on Resuscitation has formulated specific guidelines for its use in preterm infants.
At Fisher & Paykel Healthcare, our interfaces are meticulously designed and engineered to deliver intended therapies to the most vulnerable neonatal and pediatric populations. Our team is continuously innovating to help clinicians improve their care and outcomes for their patients. To learn more about the neonatal care continuum and the products that we offer, head to fphcare.com.